Hey everybody, welcome to the Old Nerd in the Gym Fitness Podcast. This is our video piece with Dr. Chelsea Walter. Hi Chelsea.
Hi.
So we just got done recording the podcast and Chelsea's going to give me an evaluation, is that what you called it?
Yeah, a brief.
A brief evaluation. She's going to kind of find out why.
She's going to evaluate your briefs?
She's going to find out, Julie's behind the camera by the way. Thanks for that. She's going to find out why I can't touch my toes and why everything hurts most of the time.
Can you find out why you can't float?
I can't float.
Huh.
I sink right to the bottom.
Interesting.
Only my top floats,
Huh.
which has been fun. So I've found ways to do that. If you keep kicking, you usually don't sink, and I've got flippers. So help me out. What are we doing here? We're going to show you how she does an evaluation, so to speak, or part one.
Yeah. So are you feeling that spot right now?
Yes, always. So
right now.
We'll press it. So I have this little back pain here. She asked me if I had any problems, so the only thing I can report is this little back pain on one side. So go ahead.
Okay. So I'm going to walk you through a couple of movements. We'll see how it feels.
Okay.
So how's your balance?
Balance is good.
All right. What I want you
Depends
to do,
on the day.
I want you to pull your right knee up to your chest.
Pull my right knee up to my chest.
Do you feel it when you do that?
Nope.
Okay. Switch sides.
Nope.
Okay. All right. Let's look at the back. So you're going to do one forward bend. Do what you can without bending your knees.
How do you do that?
Just what you can.
Without bending my knees?
Without bending your knees. What do you feel when you do that?
All kinds of pain.
Okay. Where?
Yes.
Everywhere?
It's kind of like from obviously these are really tight.
Okay.
But I feel it just coming like right there because I'm trying to force it down. So
Yeah.
I feel it turn around here.
Okay.
I feel it like here
Okay.
because that's where most of the problem is.
Okay.
And hamstrings, all
Yeah.
this is very tight because I'm pushing.
Okay.
But that's as far down as I can go.
Okay.
That's basically it.
All right.
But it's not severe by any means.
Okay. Let's go the opposite way. So put your hands on your hips. Arch back as much as you can.
Oh, how do you do that? It feels crushed.
Crushed.
Yeah.
Do you feel that spot?
I know it's there. It's not
Okay.
super painful or anything.
How does it compare to going forward?
About the same.
Okay. All right. Then face me so I can see how you're moving. I want you to slide your hips to the side. So keep your shoulders level. I know. This is a hard movement. Yeah. How's that feel?
I definitely feel it.
Okay. Go the opposite way.
Not so much. Actually, that's how I make it feel better. I like stretch
Pushing against it.
like this, is pull it,
Okay.
and then it feels better that way. But this way definitely.
How long does it feel better for?
When I do that,
Yeah.
a couple minutes.
Okay.
Doesn't last. So I'm always doing these, and
Okay.
and it's all on this side. I do yoga when I'm sitting upright. I'm doing these stretches
Okay.
over like that.
Okay. Face that way again. Do you ever feel like you lean one way or the other?
Depends on what politics is going on. I don't.
Like
I don't think so.
Okay.
I feel it pretty square.
Okay.
My bike usually falls over on the right.
I don't see a lot. So sometimes when somebody has pain on one side, they'll shift away from that side.
I don't really have
And
that.
I don't see that.
And I don't favor it because I can
Yeah.
tell that,
Yeah.
at least.
Yeah.
And I know that one of the things that I discovered a long time ago was that this came about probably in the last 10 months.
Okay.
And that's about the time that I moved my dad in with me.
Okay.
And so the stress, we have big doors open so the bugs are coming in to see us. The stress level,
Yeah.
I think had a little to do with it.
Okay.
Lack of sleep,
Okay.
all this stuff. And I think I'm just now, he's only been gone a couple months, so we're starting to catch up.
Okay.
So it's less than it was,
Okay.
but I'm also getting back to my exercise routine too.
Right.
Does that help?
But you
stuff
said
like-
exercise helps.
It does.
Moving helps.
Yeah, very much so.
Okay. All right. Remember how it felt when you went into the painful direction.
Okay.
So kind of remember that and remember how it felt when you bent.
Right.
Okay. So I'm actually going to have you lay face down.
Okay.
If you want to rest your arms on your yes. How does just laying like that feel, other than maybe a little uncomfortable with your face in the ground?
Well, it's a little uncomfortable with a couple of things in the ground, but
Okay.
I'm okay.
Okay.
Nothing really hurts.
Okay. Prop up onto your elbows. So tuck your elbows up underneath you. How does that feel?
It's crushing it. You can feel it. I don't know if it's compressed or what, but
Okay.
I can feel it.
Is it the same pain that you get?
Yes.
Okay.
But it's not severe.
Okay. Hold it there for 30 seconds. Let me know if it changes.
Please stand by. We're
Right.
experiencing technical difficulties.
There's a time component to it.
You put the Jeopardy thing in, play the music,
Right.
fake Jeopardy music. So is this typical of when you're trying to isolate a problem like this?
Yep.
Is this the kind of things that you do?
We put it in different positions and see what effect it has. So I talked about it being McKenzie certified. The other
Right.
name for that is mechanical diagnosis and therapy. So it's
Did
mechanical.
you hear that?
That's a
really,
mouthful.
That's a
It
mouthful of stuff.
Yeah. Anything changing as you're holding it.
Feels exactly the same.
Okay. Alright. I'm gonna go flat again, and you're gonna put your hands underneath your shoulders, and then I want you to press up, like you're doing a, what is it, a cobra?
Cobra,
on your back?
right?
Yep.
Ooh, she knows the names.
Yeah.
Do you want me off the floor?
I don't. I want your
Okay.
hips to
So
stay
you
down.
want the hips to
Yep.
stay down. Okay.
How does that feel?
Compressed.
Okay. Can you give me 10 of those?
Dropping down.
When did I join the army?
But let your arms.
Yeah, how do you want me to do it?
Yeah, let your arms do the work. So try to keep everything else relaxed. So keep your lower back, keep your.
Because
hips
I'm used to
relaxed.
doing this with core strength.
Right.
So,
I want this to
so
be more of
push
a
your arms.
stretch. So
All
yeah,
right.
I want your arms to do all the work here. And let me know as you do them if anything changes.
Remember what we tell everybody else. 2 more. 2 more.
no matter what, it's 2 more.
Anything changing?
It's a little less.
Okay.
Just, I'm trying to really pay attention to it.
Yeah.
Just noticeable. It's not.
You actually have some pretty good movement this way. I'm surprised based on the other stuff I tested here.
Thanks.
2 months ago when we weren't doing yoga, it would have been a whole
was
different
bad.
story.
I have, and since my dad passed away, I've lost about 4 or 5 pounds. I've gotten back into my yoga routine. I hate that he's gone now, so I can do my stuff. But
Right.
it was hard because I was focusing all my attention on him,
Right.
which is part of how this. Is that enough?
You're somewhere around 10. How's it
Okay.
feel?
Actually, better.
Okay. Give your arms a break.
Okay.
So typically I'd have you do more,
Yeah.
but
So that kind of thing.
let's
Because it is noticeable. It is
Yeah.
noticeable. I can tell
Yeah.
there's a little bit of a difference there.
see if it feels any different now to go that way.
I'm going into it.
Into what was painful.
The part that was painful. I think
Yeah.
that was this.
Thought it was the other way.
Yeah, that's a stretch.
Yeah.
I'm gonna
Same, better.
go. It's a little better.
Okay.
Yeah, it
Okay.
really is. And
Yeah.
it's just this is how like white noise constant it's been
Yeah.
that you can tell when it's a
There's
little
enough
better.
of a change.
You really
Yeah.
It's not a lot, but
Yeah.
it's noticeable.
And then try just one more.
Yeah,
One
that
more
can
time.
really do that.
That's okay. This might not be a huge difference. That might take time.
It feels about the same, but
Yeah.
it doesn't hurt.
Yeah.
It's stiff and kind of nagging, as
Yeah.
if somebody was pushing on you.
Yeah.
But it's not like an acute pain, like
Yeah.
a real sharp.
Yeah.
Nothing like that.
So I want you to test that out.
Keep doing that.
That would be your homework.
That's my homework.
That's your homework.
So I'm gonna have to do the
Yeah.
arm. There's a name for it. It's not cobra when you do it with.
It's a half dog, I believe.
It's a
I
half
think-
dog.
Up dog.
I thought up dog is when you lift.
When you
your
have to lift
toes.
your. So it is cobra
So I
on
think
the
it's
floor.
cobra
I think
here.
that's- We'll look it up and make sure I'm doing it right.
I'm not
But
doing yoga terms.
Now I'm just hurt my arms.
It will work.
She's hurt my arms now. But I need that. That's the
Yeah,
kind of stuff I'm
it'll
looking
work your
for.
arms.
With the bike up, I've got everything, like here down. So I've got nothing here. I have to do weight training.
Yeah.
So
Yeah, so if you do this every couple hours and you tell me tomorrow your triceps are sore, you're doing
then
great.
you know it.
Yeah.
Are you in pain?
How many does he have to do?
How many do I have to do every day?
I want him to do at least 10 every 2 to 3 hours.
Oh.
I
It's
know.
better to
It
leave this
shouldn't-
here.
It shouldn't take you more than, a minute to do them.
The first time.
I will record this.
You want to get that? Okay, we'll do that. We'll put some pieces of this together, and you'll just shoot me
Yeah.
doing it. And we'll.
Yeah.
It's a good thing I have this room because I'm gonna move around. It's gonna get really boring really fast. But anything else you can tell us?
And that's
That's
all
pretty
based
good.
on your symptoms, so
That's-
that wouldn't work for everybody.
Yeah, don't do that if
Based
you're
on-
not having this exact thing and you're not
Right,
me.
Right.
So everybody is very
But
different.
we work through it based on what I find.
Found something very
Yeah.
specific. So there you go. Where again can we find you?
HealthyMovementPT.com.
HealthyMovementPT.com, and on Facebook, look up Healthy Movement PT and you'll find it.
Yep.
Dr. Chelsea, thank you for helping us today.
Thanks for
And
having
remember, go listen to the podcast if you haven't heard it yet. We'll see you guys next time. Bye.